All you need to practically is to hold it position and then the path rest is theoretical. You see, half should get the two ends. This is thicker end, thinner end, thicker end is pythonic, thinner end is okay. Now, what you get here, this small curvature, lesser curvature, this large curvature, greater curvature. Okay. And we hold this stomach in such a way that the pythonic end is below and the lesser curvature faces towards the own right side. Okay. It's just like this, not like this. Okay. The lesser curvature should face towards the own right side because the lesser curvature that is at that liver. Okay, so liver right side, either touching this thing. Lesser curvature should be towards your right side. Then you see over here, this is the esophagus and this is the cardiac notch. See, this is the esophagus and this is the cardiac notch. Just left of it. See, this is the esophagus what I'm holding and this notch is cardiac notch. Okay, and see in that institute angle that is the most dependent part of the lesser curvature. So we put one line through the cardiac notch and one line to the incisor. Above the first line, it is fundus. Between first and second line, what do you do? Into the second line, pythonic part of the pythonic anterior orifice. Okay, now here, if they ask to tell the parts say two orifices, cardiac orifice, pythonic orifice, two curvatures, lesser curvature, greater curvature, two surfaces, anterior surface or anterior surface, posterior surface, and three parts, fundus, then pythonic, then pythonic. Okay. Then don't talk. Then rest is theory extensively asked. What is arteries, what are the veins, what are the lymph nodes, okay, that they ask. And they also go for the stomach vein, blood level, okay, go for the stomach vein. Okay. Then coming to spleen, see, the spleen should be always put in your left hand like this. And the convex surface should be fitting your left palm, and this is the visceral surface. And over here, how to know the upper border? Splenic notch. See, splenic notch. Splenic notch indicates the upper border. So this is the anatomy portion. Past the parts, this is medial end or posterior end. This is lateral end or anterior end. Then this is just superior border, this is inferior border. Some books call this as intermediate border. Surface resting on my palm, different surface, this is visceral surface. Part of the impression visceral surface, gastric impression, which includes hilum. This is renal impression. Just in front of the hilum is the pancreatic impression, the colon impression. On the diaphragmatic corpus, what is there? Three ribs, 9, 10, 11. 10th is the left 10th is the axis of spleen, and then your D diaphragm. Okay. Now see what I ask you extensively is theory. The ligament, what is gastrosplenic ligament, linodental, splenic. Okay, what is passing in gastrosplenic ligament? Short gastric artery, left gastric artery. What is passing in the linear ligament? Very common theory question also. That is talopancreas and splenic vessels. Then they ask which ligament, the suspension ligament of spleen, that is splenic. Which is substataculum line is support of spleen, that is splenicocollic. Okay, what is pedicular spleen, gastrosplenic, lateral taken together. Red curve, pipe curve, development in which layer, exclusive visual origin. In development doesn't mean gastro. Axial spleen they ask. Okay. And also prepare splenomegaly, what it is, and condition leading to splenomegaly. It is asked. This is the kidney. Unfortunately, we have got here only left side kidney. So right side kidney. So see over here. See, this is the kidney over here, and at the hilum, three things are there. See what I'm holding now with the renal vein. The renal vein. So thin renal vein. And this is the renal artery behind that. And this is the ureter vein. The often asked at this 14 side question, what are the structure passing in hilum of kidney, right or left, that is renal vein, artery, ureter, before that. Okay. So you get over here again the parts, okay. Upper pole, lower pole, lateral border, middle border of the hilum, anterior surface, posterior surface. They ask the relations of the anterior surface, posterior surface. The anterior surface in the right kidney has suprarenal area, then the duodenal area, hepatic area, then inside duodenal area, outside colic area. What is behind in the upper part, diaphragm and one rib on the right side. 12th rib. What is below? Three muscles, PQT. Psoas major, quadratus lumborum, and transversus abdomen. So what is lying in quadratus lumborum? So fourth vessels are now, you have the gastric nerve, ilio-lumbar nerve, and fourth lumbar artery. Now left kidney is over here, but the parts are same. The two ports, upper lower, two borders, medial lateral. Middle border there is your hilum. Then anterior surface, posterior surface. Then they ask a relation to surface. Anterior surface, totally different. You get suprarenal area, first you get suprarenal area, then to this side you get the splenic area in between gastric area. Okay. Then the pancreatic area, then the jejunal area and the column. Okay. And what is behind? Everything same except two differences. First upper part diaphragm is there, but at 2 ribs, 11, 12. In lower part the same PQT, but here there is no fourth lumbar artery, only on the right side. Okay. Then kidney, they ask a lot of things, the history of the development, polycystic kidney disease, even the bypass and they also go for the arterial segmentation of kidney. These things are asked. Okay. If answer is, they may go for the arterial circle in the kidney. Okay. Kidney is a very important disease. Next, identify this liver venagum. Okay. So how to hold the liver? The liver like waves. Okay. So the wave is broad base should be towards the right side, and the vertical, this liver venagum is vertical. And the superior surface is convex, concave, convex. Either side, convex, concave, convex. Rotate more towards the right side. Okay. So what are the surfaces and borders? Towards up, superior surface. Towards front, anterior surface. Towards back, posterior surface. Towards below, inferior surface. Towards lateral side, lateral surface. What are the borders? 3 borders. Posterior superior, posterior inferior. Out in the posterior superior border, it intervenes between superior surface, posterior surface. Posterior superior. Out in the posterior inferior border, it intervenes between posterior surface and inferior surface. Then what is the inferior border? Surface border looking down. So the border surface. Then after the resistance to show you. So above the superior surface, that is diaphragm. In the middle center upon which there is the heart with the pericardium. On either side, the lungs with pleura. In the anterior surface, right side, right posterior margin, left side, left posterior margin, in between G4 pieces. On the right hand surface, ribs. Which ribs? 7 to 11. Between the liver and the ribs, we can divide them into three thirds, upper third, middle third, lower third. In the upper third, both lungs and pleura. In the middle third, only lungs, below no lungs, no pleura. Okay. Then we go to the main features. See, this is the posterior surface. You start from that, go to that, this is the area. That's but the boundary. See, above superior coronal ligament that is reflected from liver to diaphragm. Below inferior coronal ligament that is reflected from the liver to the kidney. At the upper side of the ligament, that's passed from right from liver to diaphragm. And at the base, this one. Then the next feature is quadrate lobe. Then this is the physical ligament of Venus. They often ask ligament of Venus of patients. They ask which is remnant of doctor's premises. And this is the esophageal impression. It's all about the posterior surface. On the inferior surface, you start from the go to right. Gastric area. This ligament is ligament of pedicipardis. That is obliquely left umbilical vein. You often ask the source. Quadrate lobe. You can divide 3 parts: upper third, middle third, lower third. What is the upper third? Let's remember. In the middle third, stomach was here. So here is pylorus of stomach and passage of duodenum. And this is the place for the transverse column. Okay. Then this is the gallbladder. They ask the volume 50 milliliter. They ask the parts fundus, body, neck. They ask the duct, cystic duct. They ask the name of the artery, cystic artery. Ask the name of the vein, cystic. Right. Then they ask source of cystic artery. That is right hepatic artery and cystic vein drains to portal vein. Remember that. Okay. They often ask that. Then if here was the esophagus and the pylorus of stomach and the hospital duodenum, here is junction between first and second one. Okay. And here the transverse column, so the right column flexion. Okay. And this is the renal impression for the right kidney. Okay. Then what they ask over here is this very commonly part of inferior surface, foot path. The office probe is 40 and ask what is passing through it. Sorry, duct artery vein before that pass. Hepatic duct. Hepatic artery, portal vein. Don't tell here bile duct. That is mistake. Okay. Then see over here what else. Then they go for the ligaments. 2 ligaments, false ligament. 2 ligaments are the embryonic ligaments. Ligament pedicipardis, ligament venous. False ligaments, coronary ligament, superinferior, right triangle, left triangle ligament. Then there is your falciform ligament. Then there is your lesser omentum. Okay. Then they see here what are false ligaments, peritoneal force. Okay. But the 2 ligaments are embryonic ligaments. Okay. Now see this ligament is falciform ligament. So how then they ask lobes of liver. First, anatomical right and left lobe. Combine pisopod, ligament of venous, pisopod ligament pedicipardis with falciform ligament. That line divides it into anatomical right and left. Okay. Then that is your cholecystocvenacable line. First of all, gallbladder join that with groove for venacava. This line divides into left and right physiological. Okay. Then quadrate lobe. Inconstant lobe is Riddle's lobe. That is a trunk-like projection from the inferior border of the. Okay. This much is theory. What is visual shown? Rest.